This is our first webinar in partnership with the Dilated Cardiomyopathy Foundation on staying in care with cardiomyopathy. This is part of our Staying in Care series, and so we thought it was very important to partner between Mended Hearts and the Dilated Cardiomyopathy Foundation so that we could bring you all these resources and information about staying in care for patients with cardiomyopathy. A few housekeeping items. So all attendees are in listen only mode. And hopefully if you can't hear, you can read this. Check your audio button. A lot of times it's just you don't have your audio turned up. So make sure that you do turn your audio up and have that ready so you can hear. Please type your questions into the Q&A box. You'll see a Q&A box and there's a chat place too. We are going to use the chat tonight, but it's really helpful if you type your questions into Q&A instead of chat so we can get to them and then we can see what questions we've answered and what we still need to answer. And we will be monitoring your questions and read your questions at the end of this presentation. Also, we will have a PDF version of the slides as well as a recording of this presentation. It will be available on the Mended Hearts website and on YouTube. So this will be available to you after the webinar. So I'm going to turn it over to Greg Ruff, who is going to tell you a little bit about the DCM Foundation. Greg?
Thanks, Jody. First, I'd like to thank Mended Hearts for their partnership in this. I have been a member for 6-7 years, so thank you, Jody and Andrea. The DCM Foundation was started about 3 years ago. There wasn't a foundation specifically for dilated cardiomyopathy patients and families, and so we now have one, the DCM Foundation, and the mission is to provide hope, of course we highlight that, and support to patients and families with DCM through research, advocacy, and education. Jody?
So I'll turn it over to Andrea Bear, and who's going to tell us a little bit about Mended Hearts.
Thank you so much, Jody. So Mended Hearts' mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. And what I love is that the DCM Foundation is, their mission statement is a whole lot like ours, right? So we're all out there working hard to provide hope and support. Mended Hearts has been around since 1951, and we serve patients across the nation. In 44 states, we have chapters. And so we're excited to be partnering together.
Absolutely. And thank you both. Thank you to everyone who's here tonight to make this happen. We have an outstanding panel tonight, and I'm going to introduce you to them. It is very important for us that we have both patients and medical professionals presenting together, because together we make an expert team. We really feel like it's important to have that kind of care where we work as a team. And so this panel is just going to be perfect for this webinar tonight. First, we have Kathy Crispell, and she is a cardiovascular disease and advanced heart failure transplant specialist, and she's also a board member for the DCM Foundation. She was a specialist at the Portland, Virginia Medical Center and a faculty member at Oregon Health and Science University. She did her cardiovascular training and advanced heart failure transplant training at Oregon Health Sciences University. She remained at OHSU until 2003 when she was recruited by Northwest Kaiser Permanente as the Chief of Cardiology, Director of Cardiovascular Services, and Chief Medical Officer. Dr. Crispell retired from KPNW in 2015, but has continued to work part-time at a Portland, Virginia medical center, and most recently back at the OHSU as an adjunct associate professor. And that's VA, not Virginia. Sorry about that. And next we have Wendy Barsari from the SHARE Registry. Wendy is a patient and an expert professional. She was diagnosed with hypertrophic cardiomyopathy at the age of 24. Wendy's mother also had hypertrophic cardiomyopathy, as did several of her uncles and cousins. Wendy has 2 children who are also affected by the condition. There is a long history of the genetic condition in her family, which has led to 7 heart transplants and several incidents of sudden cardiac arrest. Today, Wendy works with the Sarcomeric Human Cardiomyopathy Registry, called the SHARE Registry, and educates people about genetic cardiomyopathy through a website, and that's www.theshareregistry.org, and through her Affairs of the Heart patient conferences held around the United States. And last but least, we have Greg Ruff, who is the president of the DCM Foundation. He is the president and founder. And in 2004, Greg was diagnosed with DCM, with an extremely weakened heart muscle and conduction system disease requiring a pacemaker. Through genetic testing, it was revealed he had 3 mutations, 2 in the LMNA gene and 1 in the TPM1 gene, which were responsible for his dilated cardiomyopathy. 9 of Greg's family members have been identified with gene mutations known to cause dilated cardiomyopathy. Over the past 31 years, he has launched and financed 7 separate entrepreneurial ventures, 6 of which have been financially successful. So we are just thrilled to have this expert panel. And I'm going to start with Kathy, who's going to talk to you a little bit about staying in care and why it's so important to her as a cardiologist. So Kathy, I'll turn it over to you.
Jody, and thank you for the nice introduction. It's certainly my pleasure to be here today and to partner with Mended Hearts. Just one more thing about my background is that I was also a nurse before I became a physician and a cardiologist. So I see healthcare in a broad way, having been taking care of people in various roles in my career. So what does staying in care mean to me? Well, people who have chronic conditions like cardiomyopathies need ongoing health care. And why do they need that? It's because these chronic conditions change, and it's really kind of unpredictable how they might change. They can worsen, they can improve, or they can be stable for long periods of time. Your healthcare team is actually monitoring for these types of changes, especially for worsening changes. Because if someone is worsening, becoming worse, developing subtle, sometimes they can be very subtle symptoms that indicate worsening, then certain kinds of interventions should be made to try to stabilize your condition. And those interventions include adjusting medications or adding medications, or if you have devices, adjusting devices sometimes is needed. And then if those things are done, then we need to monitor for the effect of those changes. Make sure that those changes are being of benefit to you and that your condition is not continuing to worsen. So staying in care is really important for doing these types of things. Currently, with COVID-19, it has been challenging for people to stay in care, and for obvious reasons. But people are also dealing with many social problems that have been exacerbated by the presence of COVID-19. And they're now dealing with many social problems that adversely can affect one's health. And staying in care and staying in touch with your health care team may be able to be a great resource for help in dealing with certain kinds of problems. And these problems include financial insecurity, housing insecurity, food insecurity, utility insecurity. If you have financial problems, you may not be able to pay for utilities, and the possibility of losing your health insurance, which may mean that you may not be able to get your medications. So these are huge problems, and staying in care may provide resources for you. Mental health challenges are also greater during this time, and we know that people are suffering from more depression, and some people are suffering from more substance abuse. And another thing that is occurring right now, which really hasn't been talked about a whole lot, but I think it's very important, is domestic abuse. So, you know, many with COVID-19 and people kind of being isolated in their homes, if you're in an abusive relationship, a victim can be isolated with their abuser. And so, so this can present a real problem as well for continuing care. But if you can reach out to your healthcare team, they may be able to get you the directed to the right resources to help one with that kind of problem. Next slide, please. So staying in care to me means the bottom line is, you know, we want you to stay as healthy and functional as possible. And we want you to stay in contact with your healthcare team. Your healthcare team are the people that know you and your condition the best. And when you have a chronic condition, it's really important to stay in touch with those people who know you and know your condition the best. And that means we want you to stay out of the emergency room. And even, you know, if you have to go to the emergency room, then you have to go. But it's best if you try to avoid going to the emergency room, and for us to try and take care of problems up front. We want people to stay out of the hospital for the same reasons. You're better if you don't have to go to the hospital. And if you stay in touch, you can possibly get help with all those insecurities that I mentioned. And you may be able to get help with your mental health issues and help with substance abuse and domestic abuse. So that's what staying in care means to me.
Thank you so much, Kathy. And now we'll go to Wendy, who's going to talk to us as a mother of a child and also as a patient herself. Wendy, tell us a little bit about what staying in care means to you.
Sure. I'm actually going to jump to the bottom of the slide and address the last bullet point first, because that I think is kind of the most important. To me, staying in care is not a to-do list. It's not something that I'm checking off a box saying, I've talked with this person, I've taken this pill today. It's really a mindset. It's me listening to my body. It's paying attention to what's going on. It's paying attention to more than that, paying attention to what's going on, what stressors I have around me that are impacting my, you know, my situation. And everything is connected. So, you know, if I'm having an off day, that's because, and I'm not sleeping, say, for instance, because I'm nervous or I'm worried or, you know, whatever other stressors are happening in my life, that affects my heart. If I have a couple nights of really, really bad night's sleep, I'm going to have more palpitations the next day. So I really, it's really a mindset. And it's something that you have to pay attention to all the time. So jumping up to the top now. So I think of myself as being an equal part of my health team. I don't see them as being an other. I'm the recipient of their care. I'm an equal part of that care. I am just as you know, if you think of legs on a stool, I'm one of the legs. And if you didn't have that, it would fall over. So I think it's really important, both as me as a patient, but as me as a mother as well, that we see ourselves as being a part of that care team. They need our knowledge of our condition. They need our knowledge of what's going on with our bodies, what feels different, even if it doesn't seem as though that symptom or whatever is going on might be related to my heart. It could be something completely different in my mind, but talk to them about that. So if you are having new symptoms or other things that are happening, even if you don't think they're related to your cardiomyopathy, talk to your health team about that, because I think sometimes things that we don't think are related might be related, or it might just be something else that they need to be aware of. So I think that's very, very important. It's very important for my medical team to understand the impact of my condition and what it's having on my life as a mother and my life as a whole. So I think I've had some very interesting conversations with my doctors over the years, and they really know just about everything there is to know about me. They know what's going on in my life at any moment, because they know that stressors can impact my heart condition and impact the symptoms that I might be having. So I talk to them about any symptoms, even if I'm not sure if it is actually related. It's also, as the mother of affected children, both my children are affected, and I think it's very important for them to also see that. They see me advocating for myself. They see me questioning physicians. They see me, if I don't understand something, I ask, and I continue asking until I understand it better. I also make great use of the portals that now all of the hospitals, all the hospitals are using, and I show them how to use those. So I'm familiar with my test results. I look up the words on my test results. I make sure I really understand what my doctors are telling me and why they're telling me to do things. And I think that's something, as a parent, I want to make sure that they understand that we are our own best advocates, and that we are just as important to our doctors as they are to us.
Absolutely. Thank you so much, Wendy.
Thank you.
And now we're going to go to Greg, and Greg is going to tell us a little bit about what staying in care means to him as a patient.
Yeah, thank you, Jody. The four main areas that I want to bring up before we get to the Q&A. First of all, as a DCM patient, I assume HCM and a lot of the cardiomyopathies are the same. It's very frustrating as a patient because the timeframes and outcomes are not known. And as we built the DCM website, Kathy was our medical expert on almost all of it. Is that there's no two paths with at least DCM and cardiomyopathy that are the same. So it's really, really difficult as a patient. You're standing in the middle of the ring, boxing this disease, and you just don't know when the last round is. So I find that frustrating. Not knowing, second one is really not knowing if I should reach out with symptoms or changes, or am I just being a hypochondriac? I think as Wendy said, I mean, you listen to your body, you see things, you see small changes. I certainly have erred to where there were gradual changes happening that I didn't really recognize fully, but I should have reached out to my medical team and didn't, and caused problems for me. But then there's always that, do I just have a cold? Do I have a headache? What is it? So I think that's hard for all cardiomyopathy patients. Making sure all of my medical team, the third one, is communicating with each other, I think is really, really important. I think what we have to do is be our own quarterback for our care and not assume people are talking to each other. They may or may not, but especially with the whole COVID thing, care has been disrupted greatly. And so you've got to make sure that you're the quarterback of your care or family members' care. And if you over communicate, I think that's a lot better than under communicating. And then also I'd like to have discussions, dealing with insurance companies, dealing with medical bills, dealing with drug costs. These are all issues. And when you're in the middle of all these other things that Kathy, Wendy, and I just mentioned, you really also have to I don't use the word fight, but you also have to advocate for yourself with all the costs. So that's frustrating. So thank you.
Yeah, absolutely. And that's, this is just a really good way to start off this webinar about talking about what staying in care means, because it can mean different things to different people. And you all brought up very different things, but very important aspects of staying in care. So I really appreciate that beginning. and setting the stage for our questions. So we've had, let me tell you all who are watching this how this is going to go. We've had some questions that people gave us ahead of time, and we will be addressing those. These will fit into these topics. I'm not necessarily going to ask questions in this order, but I'm going to ask our panelists questions. And if you have questions, please do type them in the Q&A box. We've had a couple good comments already in the chat box. If you have resources or other things or other tips for staying in care that you want to type in the chat box, please feel free to do this. We want this to be very interactive, and we want you to feel like you can give advice too as heart patients as well. So I'm going to start off with a question more about to Kathy about what you feel as a cardiologist. What do you feel like are the biggest, why are people not staying in care right now? What are the biggest impediments to people staying in care?
Well, I think there might be several. One is with COVID-19, many people are fearful of going to their doctors, going to getting out of their home and going to the doctor's office and being around other people. And that's an appropriate fear, actually. So I think that's one reason. There are, there's ways around that. We can use telemedicine to communicate with patients and to have basically doctor's appointments over the internet. So using a web-based platform to have a visit with your health care team. That may present a problem with people that don't have computers or don't have access to the internet. So there may be other options like just having a phone visit with your healthcare team. They may not be able to see you. That's one advantage of having telemedicine, is that your healthcare team members can actually see you, but you could still get a lot of information over the phone from a patient if you're a skilled provider. So those are a couple of ways around not getting care. I think another reason is that, people have lost jobs as a result of COVID-19, and they may have lost their health insurance. And so, that's a huge challenge. I think, if there is a risk of someone losing their job, it's really important for them to reach out to their healthcare team before they actually lose their health insurance, and try and be directed to resources that may be available to them before, they don't have insurance. So I think, if you're at risk of losing your insurance, kind of being proactive again, being that, being your own best advocate is really important to try to get connected to resources that can help you. So I think those are two really big reasons why people may not be staying in care at this time.
Yeah, I think that all the landscape has changed significantly, and I think those are really good points. Also, just so people are aware, open enrollment is still going on, but it ends, I think, on December 15th, if I'm not mistaken. So if you need to try to get coverage, please do so. So the next question would be kind of in the same vein to Wendy. As a patient and a mom, what have been some of your biggest obstacles to getting care for yourself and for your children?
Wendy, you're on mute.
Thank you. I was on mute. Yes. Going back to some of the things that Kathy has mentioned, I know at the very beginning of all of this with COVID, we were all very nervous. I was, if my kids had a wellness visit, we were canceling them, no dentist appointments, things like that, because we were really nervous about what was going on with it. So but to get around that, I started calling the different offices that that we needed to go into, and essentially and walking them through the protocols. Okay, when I get to your front door, what am I going to be met with? Who's going to be there? How are you how are you doing things different than what you were doing before? We have used telemedicine and telehealth. So we've had a couple of appointments on there, which has been terrific. And I think that is a burgeoning industry. I think it's just a lot of people are using that a lot more than it used to be used before. So I guess the barriers that we've had are the same ones, again, that Kathy has mentioned. But I've never let them become, if I really think something's wrong, if I really think I need to talk to somebody, I generally will reach out to my doctors by phone ahead of time. And then if a visit's needed, then a visit's needed. And I trust that the hospitals and the doctor's offices are doing what they need to make sure that I won't be sitting next to somebody that's there for a COVID test, or, that they're taking the same precautions. They want us to be healthy too. They want to keep us out of the hospital. And so I know that they're doing what they need to do to make sure that happens.
Okay, thank you. It's very good to be proactive when you need to get care. And I really think calling ahead and finding out what the landscape is can allay your fears and make you feel better about getting care. And I think that's a very good idea for everyone, and it can help calm them down and make them feel more confident when they need to get care. So Greg,
Another thing I was gonna actually jump in. Another thing I forgot to mention is right at the beginning of COVID. So because I'm a heart patient, already had a blood pressure cuff at home. But we got on Amazon just one of the little finger O2 sensors. And so there are things that we can get, to just keep an eye on things. And it's not like I'm going to say, oh, my O2 is fine, even though I'm coughing or turning blue in the face, so I don't need to do anything about it. We gotta, but it's just another path to kind of giving us some information that then we can pass along to our physicians when we do either see them or get on the phone with them.
Yeah, absolutely. And if you can have some things at home, if you have any type of heart disease, if you can have and find one that's not too expensive, but blood pressure cuffs, pulse oximeters to check your oxygen saturations. And there are even little 1 lead EKGs you can put on your phone now. And so some of those things might make you more nervous, but they might also allay some of your fears or give more information to your healthcare providers. So Greg, one of the things that you said stuck out at me, because I tend to feel the same way, is how do you know when you need to call, you need to go in, versus when today, I think we can have symptoms, we can have a cough or a sore throat, and automatically we think it's something big and bad, right? Because there's COVID and there's flu going around. So how do you determine when to get care? And can you tell us a little bit about your experiences getting care?
Yeah. I think that, first, my nature is that, I'll tough it out. I'll deal with it. It's not a big deal. It's not an issue. So, I've learned that that's not the best way to handle it. In the first 4 or 5 years with DCM, I was, tired. I had a decreased ejection fraction, certainly a pacemaker, defibrillator, arrhythmias, but I was pretty healthy. And so I didn't have to pay attention to my body nearly as much. I've sort of entered, congestive heart failure stage, where it's, and now I realize it's really important to monitor myself, because small changes could make my body and heart go haywire pretty quickly. So I think that, with my heart failure cardiologist and the team, I'm communicating a lot more every 4 or 5 days, say, hey, I've tried this with the medication and here's how my blood pressure reacted. So I think especially with online, whether it's, I don't know how many hospitals would have my chart or an equivalent, but it's pretty easy and innocuous to communicate online. Certainly, if you have any huge issues, 911 or call your medical team immediately. But I think, you know, I would over communicate, and then maybe at some point ask your medical team, am I over communicating too much? You know, but I would be cautious and pull back if you're getting negative feedback.
So I want to kind of put that similar question to you then, Kathy. When as a cardiologist, what would you like to see your patients do in terms of communicating with you, and how do you handle it if you feel like they need emergency care? What do you do in that situation?
Yeah, those are good questions. Well, I agree with the comments made by Greg and Wendy that it's really important for the patient to be their best own advocate. And if they're, you know, concerned about something, but they're not quite sure that whether they should be concerned, it's always best to call and try and talk to somebody and get some advice about what their symptoms may mean. And many times it may not be, you know, anything really significant, or maybe it is something significant, and it can be taken care of right there over the phone or through a telemedicine appointment. Other times it may be difficult for, you know, your provider to really kind of figure out what the significance of your symptoms are. And if that's the case, they may actually need to see you to really figure it out. And if that's what they think is in your best interest as the patient, then you will have to go in. And if it's something that's really urgent, they may want you to go in to the emergency room. If it's something that they don't think is quite as urgent, they may have you go into the office. But many times, I mean, we may have a difficult time really sorting out what the meaning of your symptoms are. And to really try and sort it out, we look for certain things on physical examination. And or we may need to get some blood work in addition to the physical examination to try and help sort things out, or get an electrocardiogram to help sort things out. So we may need additional information to try and sort out the significance of what you're reporting. But I agree, if you have any concerns, you need to talk to somebody. And that's kind of the bottom line.
So following up on that, Kathy, can you talk to us a little bit about when using telemedicine and telehealth is appropriate, and what kinds of things it can't be used for when you're dealing with patients with cardiomyopathy?
That's a really good question. Well, anything that you might go to the doctor's office for is appropriate for telemedicine or telehealth. So if you were going to have a routine scheduled appointment for, you know, to go to your cardiologist, instead of going to the office, that could be scheduled with telemedicine and telehealth. So that's one appropriate, very appropriate use of telemedicine or telehealth. It can be used for those concerns. So like if you call, you have concerns about something, some new symptoms, before your provider says, well, I need to see you in person, they may actually get a lot more information by just seeing you by video, you know, on telemedicine. And that may help them sort out whether or not they actually need to see you in person. So those are probably the very appropriate reasons to use telemedicine.
Okay. Well, you know, it's been a whole new world with telemedicine, and as you said, there can be barriers to it with people not having access to computers or broadband, but it's very interesting to have this new world open up of telemedicine where people can actually have an appointment, and you don't have to drive in anymore, but also you could have an appointment with a professional in a hospital that's not really close to you, which opens it up, depending on where you're getting care, it actually can open you up to getting the care from another place. If you get care from out of state, for example, you can actually get that care. So it's pretty nice to be able to do that now. So Wendy, with getting either a telemedicine visit or any kind of visit when you need care, can you talk a little bit about kind of some of the emotional aspects of it? Like what are your feelings about telemedicine, and how do you feel about just needing to get care? How do you overcome some of the fears, I guess I would say, around getting care when you need it?
Right. Well, I think a lot of it, and this is with a lot of patients, not just people with hypertrophic or with different types of cardiomyopathy, but we sometimes tend to feel as though, well, this is a symptom, but it's only going to become a problem if I talk about it, right? It's not really a problem. And oh gosh, if I go to the doctor, she's going to tell me I need to do this or I need to do this. So there is that fear. I think there is that, thinking that if we ignore it, it'll go away. Well, chances are if you ignore it, it's not going to go away. And the thing with cardiomyopathy, like Greg was mentioning, which is it's same with DCM, same with HCM, your condition can change dramatically. It can, mine has gone through times when it's improved dramatically over a number of years, and then it'll get really bad for a little while. And then, so it's a constant roller coaster. And that is stressful. That is something that we have to talk about. But I think if you have that relationship with your physician where you really can talk about those things, they want to know how you're feeling physically, but they also want to know how you're feeling emotionally. They need to see the whole you, and you need to be there to express the whole you. You're not just coming in as a patient with a symptom. You are not your diagnosis. You are a human being with a diagnosis. So I think it's really important to overcome those fears, and to know that you're going to walk away from that appointment with more knowledge than you went in with. As being a parent, I know when my kids were little, for the week before their appointments, I wouldn't get any sleep, because we were nervous about what those appointments were going to be. But at the end of the day, when we were driving away, we had more knowledge. We had more knowledge than we went in with, and we had tools in our toolbox to deal with the things that we needed to deal with, and that comes from having a very open relationship, open communication with your healthcare providers, whether it's on the phone, over a computer, or in person, however you need to reach out to them.
Have you seen any effect on your children with emotionally, like needing to get care, or have you done any telemedicine visits with your children, and how did that go?
Yeah, my daughter had one, actually they both have. Yeah, my son had a cardiology visit with his provider, but it was more just to talk about, he wanted to talk about the type of exercise he wanted to do, and he needed some input. So he didn't need to be seen. It was a perfect sort of visit to do over the phone. He just needed to have a candid conversation, with his physician. And so my son's 20 and my daughter's 17. So they're older, so I'm not dealing with this with young kids with COVID, which, my people, because that's a whole different ball game. But and then the only visit that my daughter had on telehealth was her wellness visit. And that was your typical, everything's going fine, and a private phone call in her bedroom with the doctor. So yeah, so thank goodness we haven't had to deal with a lot of the other, a lot of big issues during all of this.
Yeah, absolutely. Greg, can you talk to us a little bit? I know you've had to deal with some of the financial aspects of staying in care right now during COVID. Can you talk a little bit to us about some of the barriers and some of the financial considerations with staying in care?
Yeah, great question. And I'm not going to say the the medical institution, insurance, biopharma are bad. It's the system that we have. And anybody that I've talked to, executives in health insurance companies, heads of hospitals, executives in biopharma, have all said, hey, the system is pretty convoluted, right? So you know, I don't lay, you know, blame that, you know, on anyone in particular. It's just the system that we have, which probably needs to be cleaned up. But you know, I think the thing is you really have to advocate yourself. I mean, being in business for 31 years as an entrepreneur, I always had to advocate for myself. And you know, people are gonna make more apt to make financial mistakes in their favor than in your favor. I don't know if there's any, I don't think there's any ill meant by it, but that's just life. That's businesses. These are businesses, right? So I think one of the things you have to do is again, constantly advocate for yourself. You know, you get a denial from a health insurance, you know, claim, go to your doc and say, hey, this is, you know, what can we do to make noise? You know, you should go to you know, call their customer service number and make noise. We're going to send out a great advocacy packet of resources after this. But, you know, if you're hooked up with a Mended Hearts or DCM, say, hey, I got rejected. How, you know, do you have any resources that could help? Because again, it just happens. You always have to, probably half the major procedures I've done with DCM, I've gotten an initial denial. But I've gotten the procedure and health insurance is paid for it every single time. So advocate for yourself there. Also, you know, look at your medical bills. Look at them, scrutinize them. Don't be afraid to go back and say, this looks like a double bill. This, I mean, you know, help the medical provider, help the insurance company. You know, I got a toothbrush because I was admitted to the hospital, and does it really need to be $49? You know what I mean? So, you know, again, question, advocate for yourself. And then the same with drug prescriptions. Really ask your pharmacist, number one, hey, are there you know, cost savings programs? I've done that, and you know, a lot of the you know, heavy heart medicine, blood thinners are very expensive. They've steered me towards that. Hey, Greg, I think there's manufacturers coupons to where I've gotten a lot of these medications for 12, 24 months for free, no copay. So, you know, ask your medical provider, ask your pharmacist, reach out to the manufacturer of your prescription and search, because there are funding programs out there, but you have to look for them.
Mm-hmm. Yeah, absolutely. I want to go back to medications in a minute, but I want to follow up on something you said about, you said you get denied the first time often. So what do you do in that situation? Can you give the listeners some ideas and thoughts about when you do get a denial, how do you handle that?
I used to scream and yell, but now my heart's bad enough that I shouldn't do that anymore. So, like, I remember I was scheduled, I mean, I'm a classic layman patient, arrhythmias, very low ejection fraction, all this issue, and you know, standard procedure is a pacemaker defibrillator. Well, my insurance company, which is not the one I have now, I mean, I go that morning, they denied it. They hadn't approved it yet. So I sat, you know, again, I'm yelling at whomever I can get on the phone from that insurance company. But I, you know, again, I go back to your medical provider. You know, your cardiologist, your medical team is going to have more weight than you. And it's just sort of a game, right? I think whether they don't have, and it could be that they don't have the right information from the medical team, right? It could be that there wasn't, you know, good clarification of actually what the situation was. But again, I think advocate, get on the phone, email, and ask as many people around you to help as possible. So
yeah. Well, you know, it is interesting how many times you do get denied, or if you don't look carefully on the explanation of benefits, you can get double billed. often when my son was a baby, he had to have 2 x-rays a day because he had a lot of fluid on his lungs, and they thought it was a duplicate charge, and they denied the second one every day for like $700 a pop, so it can add up very fast when that happens. So I agree with you, just be really careful and look at it. Sam, I saw in the chat box, Sam is saying appeal, appeal, appeal. So I saw that as well. Following up on the medications, Kathy, when you are, thinking about medications in this time of COVID, and I know some people have had trouble getting their medications in the mail in a timely fashion, and people have had very big concerns about running out of medication because they have trouble getting to the pharmacy or so forth. What considerations do you have to make as a cardiologist about when you prescribe medications for cardiomyopathy?
Yeah, that's a great question. I've learned over the years that I give a lot of refills, and that I give not just a month's worth of medication when I order a prescription for somebody or write a prescription for somebody. I usually, I will discuss with the patient, what they can afford, or what their insurance will pay for, because some insurance companies have limitations on the amount of medication that they will pay for, or there are some mail order services that are actually more economical than going to the pharmacy and allow more refills than other ways of getting the medication. So I try to work with the patient depending upon what their insurance is and whether or not they have a mail order service already, because that actually gives more options to the patient. But I like to make sure that patients, especially for chronic conditions like dilated cardiomyopathy and HCM, you people that have these conditions, you need your medications. So I'd rather, give you, a year's worth of refills than just 3 months worth of refills or 6 months worth of refills, because I don't want you to run out of medications. And I want to make it as easy as possible for you to get your medications refilled, and not put barriers in front of patients to get those refills. So in general, mail order services work, from my experience in dealing with patients that have mail order services, they work really well. And also in my experience in dealing with patients, just hearing from them, they tend to be more economical. And so I really love mail order services. And depending upon where one gets their health care and what system there is, I mean, I'll just use Kaiser Permanente as an example here in the Northwest. If they prefer people to get their medications through the mail, but if you get a new prescription and you need it right away, with COVID being a challenge, people again don't want to go to the pharmacy and wait in line. I definitely understand that, and that's appropriate. So they've developed drive-through tents, basically, where people your prescriptions are called in ahead of time by the provider, and then you drive through and pick up your prescription. So people have become pretty creative in trying to get medications to patients during these challenging times.
Yeah, it is interesting. I didn't even really think about mailing. I knew you could like get your medication mailed, but it always made me nervous. Like I don't know why, it always made me nervous. And now it seems like, well, this is a really good idea during COVID, is to get your medication in the mail. And I'd like to hear from Wendy and Greg, both Wendy and then Greg, about any experience they've had with medications.
Yeah, I do all mail order for my medications, and I have for a long time. So my doctors always write them out as a 90-day supply, which is really nice. So, you know, when I am getting short, I know that I'm going to be getting another full 90 days. You know, the issue that I've had at one point was at the very beginning of this, I remember doctors saying, or it was recommended that you get a 6-month supply of some of your medications. And insurance often won't pay for that. They would give me the 3-month supply, but they wouldn't give me a 6-month supply. We haven't run into the shortages, I think, that they thought that they, you know, potentially would have with COVID, thank goodness. But yeah, we get all of our medications from mail order. We have from the very beginning. And I think it's a great, you know, it's a great system. We always have a backup with the prescription of our prescription at the local pharmacy. So if, for instance, the mail gets delayed, I know I can get right down to my local pharmacy and get a 30-day supply. And insurance will always take care of that. So.
And
I
Greg, did
actually
you?
still do the local pharmacy 30-day. Maybe I'm a creature of habit. I started doing that because the medications were so fluid. They were changing, they were upping the doses of metoprolol or whatever the medication might be. So I found it was easier since it was fluid. And honestly, I've really developed a great relationship with the pharmacist. There's several pharmacists at the large chain pharmacy I go to, and I do ask them a lot of questions. You know, they've been really, really helpful. And I consider them part of my medical team. With COVID, they've got drive-through and walk-up windows, so it's you know, I mean, fairly safe or pretty safe with COVID. So, and also I think Celeste just asked a question to the panelists or made a comment. Thank you, Celeste, that, you know, pharmacists are great. She lost her insurance and the pharmacist created or found a manufacturer's discount or online. It could be GoodRx or whatever the program is. So I like having that relationship, but you know, I realize I might be paying a little bit more.
Well, it's, you know, it's interesting how there are many different paths to go about, and now that some, like Kathy was saying, now that some of them have a drive-through, you can go through the drive-through and everything. But you know, it can be. I know heart patients who've been without medication for a few days, and when you have cardiomyopathy or heart failure, you do not want to be going without that medication. So I think it, you know, like you guys are pointing out, it's really important to make sure you keep up with your prescriptions and get those in. I want to read a couple of the ones you've answered, just so for the benefit of everyone on the webinar. And then we have one question that hasn't been answered yet that I'd like to ask you guys. And so Sam asked, what is the genetic DNA test to confirm cardiomyopathy, HCM? And Wendy, you told him there's a simple DNA test you can do from home. So that was the answer to that. And then Greg asked, how important is it to have someone else with the same or similar condition to discuss your health with, to share experiences, and thereby keeping care? And Wendy says that it's a great idea to find others with your condition to talk about your care. There are lots of avenues to do this. And we're going to be sharing resources after the webinar. And Greg, I think that's one of the things that we're all about. I mean, Mended Hearts is peer-to-peer support, and DCM as well as connecting people and giving education and resources to people. To me, having a child with a serious heart condition, I find it vital to my well-being, actually. And then you all talked about hospitals with HCM centers that have specialists to deal with some of the cardiomyopathies. And so you can go on and find out which hospitals. We always encourage our patients to ask a lot of questions and make sure you feel comfortable with whoever you go to. Get second opinions. It's never a bad idea to get a second opinion. So the question is that as measured by the Apple Watch, which is really cool, the VO2 max is gradually going down, even albeit slowly. I find that mentioning this to my doctor gets a mixed response. The answer is always, well, how do you feel? Should I be concerned about reductions in VO2 max? So Kathy, I'm going to put that to you.
Yeah, it depends upon, what your VO2 max actually is. And that is, where did you start from? And what is that trajectory of it decreasing? And, so and also the VO2 max, there may be variability in performing the test. And so, you could perform a little better one time and then another. So you look for trends. And so if the trend is that it definitely is decreasing over time, that is something to, to watch for. And that is what your cardiologist is doing. But if you started at a VO2 max of, I'm just going to throw out some numbers, of 28, and it's now 20, to a heart failure cardiologist, that's something that's noted, but something that, that they're really not going to act upon, besides giving you, the appropriate care as far as your medications are concerned and follow up and all of that. So there's nothing that needs to be intervened upon specifically at the VO2 at that level. We're looking at, VO2 is very important in trying to determine if someone is getting close to needing heart transplantation. And so, so if you're a ways from that, that's maybe one reason why that, you're getting the response you are.
And one thing, if I could add to that too, I mean, there are a lot of gizmos and gadgets out there. And I'm not going to say which ones are great, wonderful or not. If you have heart failure, you really need to go to your medical team and get proven, intense, highly monitored testing. And so I would, monitoring your health with heart failure by any type of at-home device, it might give you a pretty good, directional, but and I don't know what Kathy would say, but I'm very suspect of it. I just wouldn't do it personally.
Okay. One question in the chat box is an interesting question. I don't know if anyone knows the answer to it, but any feelings on the COVID vaccine for cardiomyopathy patients? Are most trials based on healthy subjects? Very good question. Does anyone know the answer to that?
Kathy, what are your?
Can you repeat the question again, Jody?
They're wondering about the COVID vaccine, and are the trials that they're doing on healthy subjects versus subjects with cardiomyopathy or other heart disease? That's a really good question.
Yeah, it is a good question. Yeah, I think that they are exposing healthy people in the trials to the vaccine. So, I can't really answer the question beyond that, because none of the scientific data for the trials has actually been published for review. And that's what actually the FDA is reviewing this week, all of the scientific data. And so, I wish I could answer it in more detail, but I don't have access to that information.
I know, if I can jump in quickly, generally most trials for medications, they do have to test them on not just healthy people. They generally have one level of test, where they want to test healthy people certainly at the beginning, but they also do want to test people with other comorbidities. So they probably aren't asking people specifically for cardiomyopathy, but I'm sure that in their protocols they have seen people that have other health conditions that have had had the vaccine during its trial. That's typically standard operating procedure. That it wouldn't just be healthy people that it was looking at.
Yeah, well, that's good to know. Someone else said something similar, that it's been on heart failure patients. They don't know about cardiomyopathy in the chat box as well. So, and I also one of the things that we're seeing is that they're thinking the first rollout will be healthcare providers and people in the retirement communities, or the assisted living communities rather. And then the second one would be high risk patients. So my assumption is then they have to prove it's safe for the high risk patients if that's the second phase of the rollout, you know. But going back to the question about, there's one question in the Q&A about plant-based diets. Can you talk a little bit, and then I know we're at time, but can you talk just a little bit about the kinds of things you can do at home for healthy eating, the kinds of different diets? I don't know if Greg and Wendy, you want to talk a little bit about that?
I would turn that one to Kathy first, as the
Okay.
physician in the room.
Well, plant-based diets are good, in my opinion. And I'll be upfront and frank with all of you. Cardiologists are not the best nutritionists. We're actually very poorly trained in nutrition, and I do know a little bit about plant-based diets, and plant-based diets are actually very good. I don't think one has to be totally plant-based, but if you can, most of your diet can consist primarily of plant-based, I think that's a good thing.
I think for me early on, as my health has worsened, and I'm getting fluid retention, things like that, I've always been pretty careful what we eat healthy in our household, but certainly not perfectly. I like my steak every now and again, I'm sorry. But I think that I've had to be much more conscious of what I eat in the last several months, and sodium, and so I've really gone from, hey, I eat pretty well most of the time, to very conscious about everything I put in my body, because I think you get to the point with fluid retention and congestive heart failure that you really need to be watching things very, very closely. And it's hard. You eat out, or any processed food is so high in sodium, it's really hard. My wife and I have gone online and looked at a lot of very delicious low sodium recipes for all types of different foods. So recommend that. Constant battle, but I think it's worth it. So.
Yeah. I think there are a lot of ways, I try to do a low salt diet as well. And then I also try to make sure that I'm eating the healthier fats. So, I use olive oil, I use avocado oil, instead of using a lot of heavy butters and creams and things like that. Of course, around the holidays, those numbers go up a little bit. I'm using more butter. But I use a lot of spices, and I think you can add a lot of flavor to your cooking just by adding spices to it. That's not going to add any additional sodium. I try when I eat out, I never add additional salt to my food, but you can also ask for them to not add extra salt. So they are only using whatever salt is in the ingredient so if they're using canned tomatoes, they're only using the salt that's in the canned tomatoes. They're not adding extra. And I think that's a fair thing to do when we're eating out, because we all want to once in a while, and we know it's not as healthy as eating in. But I think you can work around it with that.
Yeah, it's an interesting question, because eating healthy is part of staying in care too. What we eat at home, and it is harder with COVID. I remember in the beginning it was kind of hard to get fresh fruits and vegetables sometimes, and now it's a little better. It's been a little better lately. Hopefully, I'm knocking wood, it'll stay that way. But it's you do think about, if you're getting a lot of prepared foods and processed foods, that's definitely not good for fluid retention and your sodium levels for any of us. And snacking more because we're at home all the time, that's also something that can affect us. I'm going to move. There are wonderful comments in the chat box. We are saving the chat box, and so we are going to have that, and we are also going to have we're going to give you guys some resources and email you all some resources as well. and this again has been recorded. I want to thank you guys all for participating. I thank you for your questions. Thank you for your comments in the chat box. I want to thank our wonderful, wonderful panelists. You three were just amazing. I think you got a lot of people from the very beginning were saying how great you all are and the organizations that were involved. You can always contact us at the DCM Foundation, and you can see the phone number 1-833-DCM-HOPE, and that's dcmfoundation.org. And you can get in touch with Mended Hearts at any time at 1-888-HEART-99, and that's at www.mendedhearts.org. We appreciate all you do. Thank you again, Kathy, Greg, and Wendy. You were really wonderful. Those were great answers to the questions, and we appreciate it. Any last words, Andrea?
No, just thank you so much. It was wonderful and we appreciate it.
Bye, everyone, and have a good night.
Bye.
a
Thank you
safe and
so much
happy
for including
holiday.
us.
Happy
Happy
holidays.
holidays, everybody.
Bye.
Bye.